Hi, I'm Dr. Robert at Lakeway Cosmetic Dentistry, and if you're considering dental implants, I'd like to give you some information about why it's important to use a cone beam x-ray when treatment planning this procedure. Our office uses an ICAP Precise for the cone beam x-ray. As a dentist treatment planning implants, it's important to use a cone beam x-ray so that we can see the bone three-dimensionally. First, we can identify a lot more clearly than we could with a two-dimensional x-ray if there's actually adequate bone for us to be able to place an implant. Second, we're able to identify vital structures that we want to avoid when placing implants, like the maxillary sinus on the upper arch or the inferior alveolar nerve on the lower arch. Third, the cone beam x-ray allows us to see the density of the bone, and this allows us to know whether we're able to torque an implant into place and load it immediately. There are certain cases where we want to put an implant in, and if we can get at least 35 Newton centimeters of torque on the implant, we can then immediately place an abutment and a temporary crown. This is not so important on back teeth, but it is very important on front teeth, anything that's in the smile line. The cone beam x-ray, as opposed to a two-dimensional x-ray, gives us a much better idea of what the density is within the bone, and it allows us to know whether this is going to be an option for the patient before we go take their tooth out. Finally, our office has a software that incorporates with the CT scanner so that we can pick out the most appropriate implant for the particular situation. So if you are considering having dental implants placed, I highly recommend having a CT scan taken when treatment planning this process. If you have any further questions regarding this process, feel free to contact our office for a complimentary consultation to see if you're a good candidate for dental implants.